Public was told well in advance about the COVID appropriate behavior, how to take care, how to protect, how to prevent virus from spreading. That had been emphasized repeatedly, even on every phone call and every caller tune.
Right.
And yet, fatigue had set in to an extent that the moment unlockdown started, and by the way, unlocking was for the benefit of the economy.
Yes.
Public thought that it was meant for having fun, getting together, partying, making merry, and congregating.
The second wave of coronavirus has wreaked havoc in India, as we all know. We've seen visuals of patients struggling to find beds, ventilators, oxygen supply, crematoriums are overflowing with bodies, and mortuaries have run out of place to store the dead bodies. Now, to understand this health crisis that we're going through at present better, we're in conversation with Dr. Ashok Seth, who's the chairman and cardiologist in Fortis Escort, Delhi. Thank you so much, sir, for taking our time and speaking to me.
Thank you very much. It's a pleasure to be here talking to you.
Sir, as the COVID cases are rising in the country, we have seen visuals of what we can call the collapsing health infrastructure in the country. As I mentioned, there have been shortages of basic needs, right from ventilators to beds and much more. Do you think we were not prepared for such kind of a crisis?
So let me first say that this is truly a cause for concern and a distressing situation. And
Absolutely.
I'm talking about this steep rise in COVID. These numbers, remember last year, we had peaked around 97,000 cases per day.
Yes.
We're already beyond 2 lakhs and it is incessantly rising. So you're right, this is overwhelming our healthcare system. It is bound to, even though we are emphasizing that the less serious ones, the mild cases should be treated at home, and there are a huge number of cases being treated at home.
Yeah.
But even in just a week, active cases in Delhi have risen from 35 to 50,000. So we are actually in a very grave situation. Now, you must understand that while what has got everybody, everyone expected a second peak.
Yes.
That was,
Yes.
second wave was expected because that's what we've seen across the world. And the virologists and the epidemiologists would tell us that.
Yes.
However, I think what was not expected was the steepness of the curve, the virulence of the variant viruses.
Yes.
And that it would take us totally in a manner that we wouldn't be able to ramp up. So you see, this is not a matter of finding faults. Yes, we have to ramp up the system, but this is a time to work together. And I think if we have to say who was at fault, then everyone was at fault.
Absolutely.
Let's agree to the fact that public was told well in advance about the COVID appropriate behavior, how to take care, how to protect, how to prevent virus from spreading. That had been emphasized repeatedly, even on every phone call and every caller tune. And yet, fatigue had set in to an extent that the moment unlockdown started, and by the way, unlocking was for the benefit of the economy.
Yes.
Public thought that it was meant for having fun, getting together, partying, making merry, and congregating. But having said that, even other aspects haven't helped the situation. The fact that many people on the television, the polls in various states, the congregations, the masses, our iconic leaders across the country of various states on the platform without masks. Statements like the virus is gone, disappeared, we've killed it, we're better than other countries, we are winners, and so on and so forth, just exacerbated the whole situation into getting worse, saying everyone believing, ab to virus khatam ho gaya hai, ab to hamari life wapas aa gayi hai, dekhiye thode se hi to case hai, Hindustan sabse acha hai, Hindustan sabse aage hai. And that hasn't helped the situation. And then, of course, congregations, festivals, all that together. Clearly, we helped the virus to grow.
Absolutely.
All of us together helped the virus to grow. We had an enemy. We propagated the enemy. We actually helped the enemy. It fails me. It surprises me. It surprises all the clinical experts that how could a country help the enemy as opposed to fighting the enemy? And unfortunately, we're in a situation of total overwhelming of the healthcare system. But then let's forget the past. I think we've got to decide how to move ahead, and that's the most important aspect.
Right. Right. So, as you clearly mentioned, I think you made a very important point. This is for any virus for that matter, not just coronavirus. Any virus loves crowds, and it especially loves crowds that, violate all the protocols very brazenly. And I think that's exactly the situation in India, even with the political rallies, with the Kumbh Mela congregation, and so much more happening across the country. Now, the message that I sort of perceived from the political rallies and from these congregations is that coronavirus is a nightmare of the past, and that's when people dropped their guards and they were out everywhere in large numbers. Now, what do you think could we have done differently? What do you think the government should have done differently to tackle this situation? Because we were expecting the rise in numbers.
I think it's fruitless to discuss the past. It's to discuss what do we do now, because really we are in it.
Right.
And I think if we discuss the past, then we really will not protect ourselves now and for the future. So I'm more interested in saying, what do we do now? Because actually, our healthcare system is truly getting overwhelmed. People are suffering.
Yes.
And it is fruitless to discuss the past because everyone was involved into the past. So it's not one or the other. It's not you versus me. And as we move forwards, the clear policies have to be defined. Firstly, the only thing which will protect us today means as of today and now, is double masking, not even masking. And we've talked about masks up and so on and so forth. We know the COVID appropriate behavior is important. We know that protects us. So if you actually have to define that, yes, no congregations, no going out into crowds, no creating crowds, staying at home as much as possible, work from home, all those are important, as well as hand sanitation. But now, for those who still have to work, it's double masking. For those who still have to go out because of certain specific reasons, it has to be double masking. And what I mean by double masking, that's been well shown, by the way. And through your channel, I want to emphasize this, because it saves lives as of today and stops the virus spreading as of now. Absolutely. Double masking means that we see that the majority of the public do wear cloth masks. Okay. It's only the doctors and a few other people who are well exposed wear the N95, which are expensive. They got cheaper and cheaper, but not everyone can afford them. But everybody can afford the washable cloth mask. Now, all one has to wear is a 3-ply surgical mask, which cost ₹1, ₹1.50, under the cloth mask, close to the face. And if the cloth mask is on over it, just with, say, a cloth mask, you stop the spread of virus by 45%. That's both sides. Okay. You wear a surgical mask, that also stops the virus by 50%, but you wear both, it stops the spread of virus by 85%. And if both parties wear it, then it stops the spread of the virus by 97%. I think that's what we need to do now. Second aspect is that we well realize that whatever the effectiveness of every strategy we put into position now is going to bear its fruits over a period of few weeks and months. And that goes for vaccination. We know that the only thing which will save our lives and having severe illness is vaccine. It may not prevent us from getting the infection, but it will prevent us from getting serious infection and dying. And therefore, vaccinate, and have vaccination. Forget vaccine hesitancy, because that's what is going to save us from 4 to 6 weeks now. And from the policies, I say, it has to be now defined, clear policies with strict implementation. Unfortunately, we define the policies, but do not have strict implementation of those policies. And these policies have to define absolutely no congregation, absolutely no crowds, absolutely no parties, forget all those. Have strict vigilance, make it legal rule to define and implement those policies, which have to be now very strict. This is what's going to save us for the future. But then there's all these issues around beds, which we have to discuss, and I'm happy to discuss those aspects as well.
Absolutely. So adding on to what you just mentioned, obviously this entire coronavirus situation is very overwhelming for the health infrastructure, for the health workers. They are burnt out. They're working way more than they're supposed to. But do you think we have underfunded the health sector all of these years?
Yes, that's certainly true. I think what Corona has done is certainly define the importance of the healthcare structure.
Yes.
And defined the four pillars of the healthcare. Remember, it's not just the beds. We've always been devoid of bed. We've always been devoid of personnel. We've always been devoid of funding. It's been one of those reluctance issues. Health has been reluctantly being funded. And by the way, that was only a % funding of the whole GDP. Now, really, the four pillars have become far more important. And that is not just the infrastructure, not just the quality of the infrastructure, not just the quantity of the infrastructure which saves lives, but also research, development, and the partnership between the public and the private sector. These four pillars became very important and cemented during this time, where the private sector stood up to its responsibility, shoulder to shoulder with the government, to believe that this was a war and we have to be in it together. And every doctor, every healthcare worker, every frontline worker was in it like the country is at war and we have to be together. I think this is a great opportunity to start understanding how we have to move ahead with this healthcare.
Yes.
It's unfortunate that even at this time, the healthcare infrastructure is incomplete. It is unfortunate that even at this time, we are actually having to decide between COVID patients versus non-COVID patients.
Yes. Yes.
Should we actually be treating and saving lives from COVID? And should we be forgetting a patient who comes in with heart attack, a patient who needs a bypass surgery, a patient who's had a stroke, shouldn't we be saving his life? A patient who comes in with pneumonia in the critical care unit, or a patient who comes in with trauma, shouldn't we be saving his lives? Those lives are equally important to be saved as much as a corona life. Why have we got into a stage of making these choices? Why didn't we have an infrastructure which could allow us to do all? Obviously, the answer is that India is too big. Even the Western healthcare infrastructure had got overwhelmed and annihilated. But it actually makes us think forward. This is our learning experience that we can do it. We have the ability as a large nation to do it. And we should be looking at the ground root level and the grassroots levels to say, how can we have all-round growth of healthcare in a close partnership between the public and the private sector for all aspects of healthcare for the future? Not to look at each other with suspicion, not to look at each other as opposing parties sitting on the opposite side of the table, delivering different types of healthcare in a single country, and not to look at it as two railway tracks which seem to be running parallel together, meeting in the future but never meet. I think that's what this COVID has taught us.
Absolutely. So as you rightly mentioned earlier as well, the onus for this entire situation that we are part of right now lies with us. We're equally responsible for bringing up the numbers, for our carelessness, for our reckless attitude. But at the same time, when we also discuss that the blame game should end and, it's a collective responsibility, we also look at political leaders, collectively participating in the Kumbh Mela or in election rallies. And these are the people who are influential. They influence minds. So if I see a political leader coming out with his, ministers and other people for a political rally or an election rally or a religious congregation, I somehow feel that I have the license to go out because that's what my leader is doing. What do you have to say about this? Because even for the Kumbh Mela, it has become a hotspot now.
See, I agree with you. I would tend to agree with that aspect. Yes, we rely on every leader, be it a celebrity, be it a political leader. We rely on them to, if they have to say these things, then all have to practice it. If I'm today preaching about this double masking, I do double mask and I actually wear masks at home.
Exactly.
And I'm only without a mask because I'm alone in this room. But even with my father and with my family, I'm still wearing a mask. So the real issue is that, yes, leaders have to be representative. Leaders are followed. Leaders celebrities are looked upon. And that is why it's very clear that we have to actually, so certainly that translated to some of the carelessness and callousness on a population which had already had COVID fatigue.
Exactly. Yes.
And so there was that part of it. And by the way, let's not also forget that India itself has socio-economic groups.
Yes.
For whom social distancing is a cruel joke. We have urban slums, unfortunately. Pardon my statement calling that urban slums, but that's true. We all realize it. That's the reality of India, that in a small room of 10 by 10, we may actually have a family of 5 people. And then we talk to them about distancing, we talk to them about masking, and they're looking for the next bread and butter. They're looking for their food, and they're looking. So what are we talking to them about? And unfortunately, we have a large population of those as well. So our socioeconomic status, unfortunately, isn't the soundest. Our discipline within our own country, if we are not well recognized for discipline, we well know that.
Yes.
And unless something is mandated and mandated by law, we just don't seem to. We don't seem to follow it. It's like a seat belt. It's like driving, not driving in the lanes. I mean, we're going through traffic lights. So unfortunately, that we already are a nation which is like that, and then we have unfortunately those scenes of others who are representing the nation at the moment, displaying the fact that they're not wearing masks, and that doesn't create that creates the worst milieu for promoting this virus, I must say. Yes, you're right about it. So that I have also felt that it was unfortunate that we had to have so many rallies, so many politicians of all forms, of all states, and then so many iconic leaders, so many celebrities who were all without masks. And then what does the common man see? He sees that. He sees that every day.
Yes. Dr. Seth, do you think the situation is going to get worse? And if yes, what do you think we as individuals can practice, in our own limited space, in our own limited capacity, to sort of defeat the virus or tackle it when it gets worse?
So in our own capacity, I exactly emphasize those 2 very important points: the masking and the double masking. There's no question in my mind about that. We emphasize the fact about hand washing, hand hygiene. Absolutely very clear. No gatherings, distancing, only go out as needed. Maintain self-discipline. Our lives in our hands, is in our hands. But I think people have to understand that others' lives are also in our hands.
Absolutely.
And I think we owe it to others. Masking. You see, I may actually believe that doesn't matter. I'll get a mild illness. I'll survive. But when I pass it on to 5 other people, then whether someone else survives or not also becomes my responsibility. Now, how would it feel to a person, and I say that to your listeners, your viewers, is that if I was the cause of introducing the virus in my own home, and then one of my own relatives got it who succumbed from it, it could be my parents, it could be anybody. And then how would I excuse myself? How would I pardon myself? Or how would I feel guilty for the rest of my life?
Absolutely.
So it's not just me, it's others around me. And the second important point I think I want people to understand is now we actually dealing with the multiple variants. We saw last time that if a family got the infection, there would be a member or 2 of the family. The rest, even if they were living together in the same house, would not get it. Now we're seeing 5 members of a family, 7 members of family, all getting it together. So the variants of concern which have come in, and there are a few of them, are actually far more vicious and virulent than the ones before. That's what's creating another spike in another manner. And we're not certain whether they're bypassing our immune system, and therefore it's even a bigger matter of concern. So I think now everything is in our hands.
Yes.
Vaccine hesitancy will not help any further. Anybody who hasn't got vaccinated, who still falls in the group, we should get vaccinated, should get vaccinated. And I say to younger people that it is not the time to enjoy yourself, have fun time, party, get together in a congregation, gathering, etc. Because young people are known to survive. And by the way, at this time, a number of young people are getting the infections, are getting admitted to the hospital. But the real issue is that you will take the virus home and you will give it, unfortunately, to others at your home who are elderly, who are susceptible, who have comorbid conditions. And one of those is going to succumb to it. That's not going to be that's going to be a very sad event.
Absolutely. Dr. Said, I must say you've made some really important points. You've highlighted how the responsibility lies with us and how we are not just responsible for our safety, but others as well. I'd again like to thank you for taking out time and speaking to me. Thank you so much.
Thank you very much. It was a pleasure speaking to you.